I lied a little bit. I said I'm going to introduce the panelists, but I'm not going to do it too much. You guys have the handout. This is Kris McCann from Bay Area Housing Corporation, a wonderful person and my co-chair tonight. Thank you, Kris. Santi Rogers, the new director of DDS, the current director of San Andreas Regional Center. Tony Anderson from the ARC of California. They drove, and he and Marty Omoto from CDCAN drove all the way from Sacramento today. Thank you very much. We're honored to have you here. So we're going to start with Santi. Santi, you just got a really big job, a very important job at what is probably the most important time in the history of developmental services in the state, in my opinion. No pressure. No pressure, no pressure. We just have, 70,000 people with substantial autism who will, need services, no problem. But I wouldn't mind, and I'm sure everyone wouldn't mind hearing a little bit about your perspective in this week before you start your job.
Okay. Good evening, everybody. Good to see 1/3 of you I know, the other third I almost know, and the other third I don't know at all, so you can see me right afterwards, and we can discuss things. It's a pleasure to be here with you all tonight. Some of you who I've known for a long time, I'm an avid historian. I've had the blessing, this is now moving into my 46th year of serving families, individuals with special needs in California. I came in right during the time when developmental centers, there were 11 of them, they were called state hospitals. And right out of graduate school, I went to work at Porterville State Hospital. Porterville is in Tulare County. How many know where Tulare County is? A little audience activity is really helpful. I am a behaviorist. Good job. The serious part about that history that I always carry around with me, many of you know this, many legislators over the decades know it, whatever the current version of the Lanterman Developmental Disability Services Act, originally the Lanterman Act, I carry it around. You're not going to get through a whole evening without me mentioning what I have in my right hand. This is a piece of civil rights legislation. Having the pleasure and the honor of knowing a number of those moms, they really look like my own mother. I was born in Fresno, California, in an Italian-American Azoran family. The last name Rogers was anglicized from Rodriguez de Tevez. My father, this is important now, my father, family came from the Azores. My father was a first-generation California American. My grandfather, Santi, whom I'm named after, my father's father had passed when my father was only 4. And my mother and my father met on a blind date. Her name was
Santi,
Amelia.
DDS.
Yes, I am.
Okay.
You wanted to know what I think about the future of DDS. The part of DDS is the significant part of it. It has to do with the history we have, and many of us are still living the civil rights aspect of it. Relative to what's going to happen with the future of developmental services, it's not only in this room, they're in the same rooms in all 58 of our counties. I've had the pleasure of meeting people who are committed to their sons and daughters, and that commitment is outlined here. So often we gloss over those individual notions about self-determination, about what is in the best interest of my son and my daughter. And I'll tell you right now, philosophically, and she just spoke of it, interesting enough in both the survey, no place like home. No place like home. I bring to you a message as a new director of developmental services, once I sworn in, and that March 3rd, by the way, it's a really important day. You may want to mark it on your calendar. That's the beginning of time your behavioral program starts with me. The serious part about that is the commitment to those basic principles, that a good, wholesome place to live, the confidence that my son and daughter will have a great place to live, the confidence that they'll have the opportunity to access what all of us in this room value. First thing people ask you after your name is, where do you work? Where do you work? That's a significant issue with all of us and continues to be. And the other part of what I call a good life is a wonderful opportunity to socialize. Regardless of what skills you may or may not have in your repertoire, is the opportunity to develop relationships. The relationships that you choose. Think about that. Relationships that you choose. Some of us in this room are grand occasioners. We provide the occasion for things to happen. And I believe we have a lot to do. Obviously, the numbers that already have been shared with you by Jill are extraordinary numbers. Never before we had this many people across the United States identified with the challenges associated with autism and the whole spectrum. And I believe we'll find more and more about that as we move along. Department of Developmental Services is in a natural transition. As I mentioned before, significantly about that transition, and all of the governors who have overseen this, the occasioner from Jerry Brown's dad, all the way through now to Jerry Brown the second time around. Third time around, I guess, if you really want to be technical. I think he knows and really has in his heart the seriousness of what we have, and I think he will hear and has already heard that we, all of us, are extraordinary advocates. If you're not an advocate, raise your hand. Okay. Also on my points here are relatively simple. There are things in any transition that are incredible. We'll have a new director of developmental services. We have a new chief deputy that was sworn in a week ago, yesterday, I think, whatever day this is. This is Wednesday, right? Yesterday, John Doyle. And from there, we will be looking at all of the assets that we have in each of our key positions. I can already tell you there will need to be augmentation to our vacancies that we have at the regional centers, as well as specifically at the Department of Developmental Services. The biggest difference I already outlined for you. The big difference is the focus on our basic values that were in the tenets of the Lanterman Act when it was first developed. It is, like I said, supporting families across the spectrum of California. That is a significant, significant challenge when you look at the details of it. Some of you in this room, we've had the opportunity to work together in doing just that. Bringing advocacy is bringing these wherever way you can get these there, and this, and this, and this, to those folks that will have responsibilities. The challenges now that from these gentlemen I have here and this wonderful ladies here, the real challenges, I'm sorry, I'm half Italian. It's really dangerous for sitting anywhere near me. The challenge is that in term limits, it's really difficult to continue the story from one transition to another. You already know that. So what now that you know it? What are you going to do about it? The attitude and the really, really specific suggestion is intimacy is good. Intimacy is good. And with it, you bring your feelings and your heart to the issues. They are really, really clear, and the person's being served having the opportunity themselves to speak for themselves. Many of us have been providers of the occasion for independence. With independence comes all kinds of behavior, does it not? And some of that you really like, and some of it you may not like very well. And the way to deal with that is just deal with it. I'm really optimistic about it. We're in a time of 5 years of systemic reduction of services. It's incredible. I haven't seen any comparison to it in my 45 years. Just reduction of services. To rebuild that takes a real challenge, and it takes a public policy commitment more than what's going to be spoken here tonight. And that comes from each of you in here. Many of you are very, very active, are social activists. Maybe some of you were born in the 1940s, and you'll learn that maybe from your own parents, or maybe some of you, because you won't disclose, I hope, on campuses, wherever you were able to access, might have been speaking your feelings, your strong feelings. And I already got one hand in the air, but thank you very much for that. The realities are, I don't think you should put that aside. And each of the regions in California, all 58 wonderful counties are represented in this great state, and being involved intimately, there is no substitute for it. This legislature has a huge challenge from my reading of it as a director of a regional center. I've been there now, moving on to my 19th year, and prior to that, those 28, 29 years, and all the other aspects of the service. And I'll tell you, during that time, period, we've seen huge transformations. We've seen things that we knew we were going to have to do some accommodations to make it to the next year. I think we have a real good opportunity in this legislature. The leadership changes that are happening as we speak, you're already aware of it. I know most of you in this room, I was joking a little bit before, I only know a third of you, are already out there trying to meet that new leadership. We have to know them well. From a regional center, and whether or not you're with the administration, we have to spend quite a bit of time of explaining what the intricacies of 260,000 people, many of them the second largest group, are persons who are eligible under the Lanham and Developmental Disabilities Services Act under the category of autism. Think about that. That's a huge number, bigger than any other state, bigger proportions than most of the other governments of having that responsibility. And it's not cost neutral.
Not cost neutral. Well, Santi was talking about advocacy, and one of our purposes tonight, obviously, is to really hone in. We're not going to just go meet with legislators and complain, right? We're going to go meet with legislators and with Santi and all of his people and his bodyguards, and just ask for specific, meaningful changes, right? We don't want to go in and say, we need more money. Well, yeah, of course we need more money, but what is the most effective use of that money? So let's start moving on to the issues, if you don't mind, because that's why we're here. I'm going to skip over to Marty. Marty, we're all, where's Marty? There he is. We're all amateurs here. You're not, but we're all amateurs. And one thing we've really learned is collaboration is key. Like, we are at Autism Society a total collaboration machine, right? We're the octopus reaching everywhere. And we know, this is not going to happen in a day. These changes that we need for adult ASD services, this is going to take us years to build. I want you to give us amateurs some advice about coalition building, collaboration in the disability kind of network and world.
Well, I consider myself an amateur in the sense that I think if an amateur is a person who is in a constant state of learning, then I think that's the best thing to always be. And that's what we all should be, as amateurs in advocacy, never wanting to stop learning. And so that's number one, the first advice I can give. The other is, I'm going to show you a sign. You probably can't see it from here. It says the whole world is watching. And it was a big rally that we did on April 7th, 2003. Actually, Santi, you helped with that. And it was extraordinary, and Sibby is out there in the audience there, and she was there, and she actually was one of the speakers. What was extraordinary about it is 3,000 people came from all across California because of the massive proposed cuts under then Governor Gray Davis. And why it was so extraordinary is a small group of us got together and decided to band together and not let the boundaries of whether we are a regional center or a provider or a family or an advocate, like you have in the front seat there. No matter what your philosophy was, whether you had a child in a developmental center, what really mattered and what was center place, and this is what Santi and others here on this panel have talked about, is we're talking about lives that matter. This is a picture of my sister. She had developmental disabilities. She passed away actually a few days before this rally was held. And she lived in Monterey with my father. If we always remember that it's lives that matter and that every life matters, then that will lead us to do the right things in the right way. It also will lead us that time is of the essence. For any of you who are family members, you know that time is of the essence. And so if any work that we do as advocates only leads us to more talk, then that's not helping anyone. And so one of the things that we've always pressed over the past 10 years, we were fighting cuts for the past 10 years, or 15 years actually, but what we really have to do is press hard for solutions. Not ask, but press. Not confront, but engage. There's the old line about when you pray, move your feet. And Santi was talking about using your feet there. The thing is, we can't be outside the room. where decisions are made. There's a line from the show West Wing where they say, decisions are made by those who show up. And decisions are also made by others when we aren't there. And so now we have to consider, how do we change our advocacy now to press for not only restoration of all these programs that have been cut over the past 10 to 15 years, since actually 2002, but how do we now also build a new system for the future? We can't just restore what was. We have to look to rebuilding a new system that what must be in the 21st century. We cannot use as our advocacy only what was as our best defense. We have to look to what is new and different. And that's not going to be easy. A lot of us are wedded to the old style of advocacy, to the old programs, and every one of us has to turn inward and question what we do and how can we do it better, and if there's another solution out there. And so that's my answer. To cap it is with a quote from Gandhi. We must be the change that we see in the world. We must be the change. And so if that means supported living, which I value very much, in-home supported services, day program, every one of these things, yeah, they're good, but they need to change, and they need to be better. They need to be more efficient. And it's not make me an opponent of community-based living. It makes me a proponent of what we need to look for in the future.
Okay, thank you. Thank you, Marty.
It was a long answer, wasn't it?
I'm going to actually skip around some of the topics a little bit, and I am going to actually jump into the housing issue. We talked about the three legs of the stool being, housing, staff, and this sort of, day program or employment. Housing is actually one of the easier ones. It's a lot less expensive than the staff issue. It's a lot less complicated than the staff issue, but it is still a significant issue. 80% of people with autism, adults with autism, continue to live in the family home, and that number is higher for those who are in their younger 20s. It's about 90%. So when we talk about housing for autism, we're really talking about our own roofs for the most part. And, we've worked with a lot of parents with autism in the course of this initiative. And a lot of people want to keep their kids at home. A lot of people don't want to, too, believe me. But for those who want to, it's only possible, they say, and I say it too, if there is a place for them in the community, right, that's not the family home during the day. Am I hearing this kind of right from a lot of people? Yes, I think I am. And, but there's a problem with that when it comes to adults with autism. Remember, this is kind of a brand new thing. This kind of autism has not been around. We're dealing with an unprecedented situation. We don't have in the community these programs for our kids. We have schools. The schools had to struggle, right, to build these programs and to, and the nonprofits to expand them. We don't have the equivalent for adults. Right? Now, if you're a higher functioning person, you could maybe get a job or supported employment, and that's great. But a lot of our kids can't. I know my kids won't be able to. So this is kind of an everyone question. I think we'll start with Tony, though. If one of our goals at the end of the day is to create really a brand new, vastly expanded network of adult day programs, or whatever you want to call them, places, the home away from home for these people with autism. What's the best way to go about that? And I'll give you a little, I'm sorry I'm talking so much, I'll stop soon. I'll give you an example. There are nonprofits here in Silicon Valley that would like to expand. They have waiting lists, like this, right? Well, they can't afford to rent space. They can't afford to buy space. The rates they get from the state are so low they can barely even pay the staff. They can't pay overhead. They can't pay startup costs. They can't pay rent. So what are some suggestions you have for creating this capacity? Long question, sorry.
Well, you've got to remember that we don't just live in our own state with our own wall around it, and other policies don't come in to impact this. There are so many things occurring on the national level that are going to find their way into California in changing the way we operate, in particular the day programs and the workshop models that we've had over many, many years. And it's going to be, it's not going to be an easy transition. We've spent a lot of heart and soul and money, and a lot of people have put a lot of their lives and families' lives into building this infrastructure for building day programs and trying to get people to learn how to work and to get jobs. And it hasn't, for the most part, it hasn't been the most successful model in terms of getting people long-term jobs. Now, having said that, there are people who really enjoy the existing programs that are out there today, and making those changes with these families that really enjoy what they have and the person with a disability that enjoys what they have, making the model change with everybody in place in a way that's going to be the least damaging, and I really mean damaging in a way that will really disrupt people's lives. So we need to be careful with that as things move along. But there are, I'll go back to my very beginning about the federal piece. There are lawsuits in other states that are really, and the states are responding by saying, well, we've got to change it because the law is saying that we have to change it. It's the Oregon suit for one, and the state is just saying no more workshops, and in some places no more day programs. And in New Jersey, same thing.
But who's saying no more day programs?
Now, what's happening is that there are lawsuits, and the federal government is saying that the ruling is that these are a violation of Olmstead. And that's sort of how far it goes. And the state's response to it is that's the piece in some of these states that concern a lot of people. Now, it's not everywhere, but it is a beginning, and it is something for us to really look at, examine what's going on, where is the validity. This is based in, this is the federal government saying, the Department of Labor saying, look, this is a serious problem. And Tom Perez, who's in charge, now he was a great advocate for us when he went into developmental centers across the country and found violations and really put the screws to some of these developmental centers and closed them, especially in Virginia in particular. So he's a great advocate. And he's the leader of this department now, and we're really looking at that. So the point is that there are big national pressures that are coming down that other states are looking at how they're going to respond. And it's going to make us change in some way. Now, how we do that is going to be, it's going to have to be thoughtful, in my view. And then your graph here with the population and looking at the boom, the adults with autism that are coming into the adult world now, and their needs. And it's actually good timing, because if we have to change the entire system, this is the time that we're going to have to relook at the way we're responding and meeting different families' needs and meeting the needs of self-advocates and what they're asking for and what they're demanding for. And then the system itself, we cannot blame those people that are doing the services that they're doing today. That they didn't make referrals into their programs. They made those programs because families, regional centers, everybody asked them to do that. And they did a great job. And they built in this incredible infrastructure of day programs, work-related programs. And families played a huge role in building that. And now to condemn them and to fault them for it will cause a big explosion and a fight that we don't need in our community, and will delay the process. And I know the process is going to move forward. And there might be times where you'll hear me say, hold on, don't make any change at all. And it might be just because of that. We need to make sure we do it in a way, in terms of it, meaning evolve, in a way that will meet everyone's needs as best we can.
Santi, so here I am saying, boy, oh boy, this state needs hundreds, if not thousands, of new adult day programs for the more substantially disabled, right? Kind of school for life, if you will. Okay. And I look out there and I don't see anything happening, right? What do you think? What would you be able to advocate for in your new politically difficult position.
Well, identifying the unmet needs, as he just eloquently spoke about, is not our biggest challenge. We already have identified significant unmet needs. Establishing and starting up new. This budget actually has some hope in it. At the same time, it will have to be done incrementally because that is a reality. How and what goes first should be interesting discussions in the budget process coming. And I'm not just, many people are sophisticated in this audience, correct? You understand the May revision of the budget, and all of that part is another set. The governor has released his budget. There are missing pieces in the budget like it always is, and there will be opportunities for people to raise some of those focus issues. What would you do first is the question I'd ask you and everyone else in this room. What would you do next, and what next approximation would you do? Because as already has been spoken, there are commitments, legacy commitments to services that people receive. Never before we had this many 50, listen close, 60, 70, 80, and 90-year-olds. Never before we've had so many of the people that we serve under this great act joining those groups. So this wave that we have, and the double or triple wave, if Rick Rollins was here tonight, he would tell you about the triple wave, is obviously a compelling issue. And those voices are heard loud and clear. So what do we do next? I think home-based meaning geographically home-based, work options. And those work options we have a lot of experience with now. It's sort of like supported work in a more progressive way. Partnering with exactly folks that already know how to create work. Remember that we have a huge underemployed population in California. You hear about it from the talking heads on television constantly. Underemployed. So not just unemployed, but underemployed. That's a competitor in many different ways. I don't think we've ever come up with an idea, a vehicle by which to actually access that in a partnership. I think that's a possibility because we have some legendary advocates, but it has to be very specific. So easily said, the fuel to do some of that, I'm optimistic about the fuel to do some of that. And the fuel is more than just dollars. It's actually public policy support to move in those approximations. So work is a vital part of our success formula, and that's the best way I can explain.
Well, yeah, I can tell you that I know one of our priorities will end up being the expansion of these programs and some sort of greasing the wheels to make these things happen through the nonprofit community. So we'll be talking. We'll be talking about that. So generally, for all of you, when parents can no longer care for the adult with autism who's maybe living at home, what happens? Because I think that's going to happen more and more and more and more and more.
But they're not all adults.
Oh,
That's right. Children that need housing too. Just a gentle reminder. The children that need housing.
I absolutely agree with that. I would never deny that. Yeah. Okay.
Just gentle. Sorry.
Okay. Okay. So what is do you have you been, not you, you aren't even in your job yet. So, just thinking about this coming problem that you're going to have an increasing number of dependent adults, right, without a caregiver.
Right. And is that a question for all
It's
of us?
It's a kind for all of you. Yeah, we could start with you.
I'll let somebody else speak too, because I always...
I think you should go.
Go first.
As has already been mentioned, you have to look at the whole spectrum of chronological age. Okay, so there we have those issues occurring at each of the age groups. The numbers are staggering, as you've already mentioned, and I'll rest that for a second, because we really look at where are people going to live in a wholesome environment, and that can be more than just one place in the course of our life. Really think about that. That's not a shallow comment from somebody who's going to get appointed to something. There was an informed consent there, by the way. I said yes. So the serious part about it is that we will probably address how you can do that incrementally across the whole state, a great state of California. We have some very creative people in California already thinking about micro examples of that for both children and young adults and older adults. The challenge to do that will give us the demonstration of some of the who does what by when and how much the costs associated with it, because we're greeted with cost all the time. Any good idea. I have confidence in Californians who start up things that are in the garage, and I mean affectionately a very high quality garage. From there comes base programs. Sometimes here in the state, we have to touch it, feel it, smell it in order to support it. And you've heard other elected officials tell you that, but some of us are purveyors of that. We have actually done that, and we watch in other states. You speak of the great state of Oregon. I love to be in Oregon. I like it. I just came back from there. Unexpectedly, I had a vacation before I ever got invited to be a director of something. And I was in Oregon, and Oregon has already done a couple of creative things. They separated the ownership from the delivery of ownership of housing from the delivery of service. So the owner of the house can't deliver the service. That's very creative when you look at the base. Same thing holds true for other kind of life, rhythm of life opportunities, which include work. We think that's a possibility in this state. How would we invest in it? We would have, we're not very regulated here in the state. That's supposed to be a joke. Just talking about it has already got me in trouble. Yeah, I know this isn't tape, but we're only on the planet a short time. So, and that's also on tape, right?
Yeah.
If there's an accident on my way home, you tell me how that worked. Okay. The serious part is that is doable. We just have to have the opportunity to exercise what we already know what to do. Yeah. And in each of our sub-communities. We have some very creative people in California, and I think there's the way to go. That doesn't separate from the issue of where to live, because I made it relatively simple when I was sharing it from my teachers. A good, live, work, play, a good life is the place to live using the same operational parameters of how you create housing. Many of the things that we created across the state did not comply with conventional wisdom, and it included services for children.
Tony.
I'd like to add on the parent piece, one thing that we find is some of the parents, when they've got, let's say, school in place, they're done. They just focus on the school and we're good. And that's not really what we need. We need them looking at the next level. So they should be, at that point, looking at the work. Once they get there, what we've got is a lot of parents who will ignore the next step level until it becomes time to work in that area. And then they'll show up and do it. And what we hear time and again from the parents that show up eventually to the different meetings or different policy groups that we're working on is, I should have done this before I needed it. Because now I need it right now, and it's still in the making. And a lot of work goes into building the structures that families need. But when we wait for the generation ahead to do it, they could be done with that and working on the next step. So it's just so critical to not allow parents to rest, right? And to continue to develop and evolve.
I talk to people all the time. My autistic kids are 7 and almost 15. And I talk to people all the time, why are you doing this adult thing? Like, hello? In a blink of an eye, these people are going to be adults. And just like everyone else in this room, I want to make sure there's a place for them in the world. And you're right, we cannot start soon enough on these things. I'm not getting a lot of specific answers from my panelists tonight. Let's move to Kris, and I'm going to try to dig in a little bit.
I have a daughter with a developmental disability. Darcy's right there with cerebral palsy. And about 18, 19 years ago, I got into the housing world. And I see some parents out there. And the first thing I would say as a parent, be there. The fact that you're coming to these meetings now, when you talk about a child, and your child that may have autism, to get involved now, because the people that show up learn the most and are able to be advocates. So I certainly showed up for my child, and then from there it was, what about all those kids out there that really need the assistance? And I'm going to just give a little bit of a perspective if I can. I mean, the Lanterman Act is just the most incredible piece of legislation and it impacts the state of California. And I'm not trying to make this sound all ooey-ooey, but we've got something that most of the other states do not have. So for that, I am really, really grateful. If you're going to have a disability, I'm glad, Darcy, I'm glad you have a developmental disability, and at least we get some services to the state of California. So for that, I have gratitude. But I don't think it's enough to, as parents, to say, well, what are they going to do for me? I think it's really important that we need to take care of our own children. And you need to be educated, you need to advocate, you need your partnerships around you. And you need, one of the things we did with Claire and Sibby, and we started dreaming of what kind of a place would we love our child to live in. And we asked them, what kind of a place would they like to live in? And a lot of them, and it's like, so many want to live at home, which is wonderful, and that yet you need that sort of that nudge a little bit to sort of move them, because we're not going to be there for long periods of time. So to know about when waiting lists come up, I hope everybody here is part of Housing Choices waiting list. So when opportunities come up in housing, we create more housing. By the way,
parenthetical, explain Housing Choices.
Housing Choices Coalition is a nonprofit out of San Andreas Regional Center. I was the founding executive director of it. We've got some founding board members. Claire McDermott was the chair of the board. And we created that organization, and it was a group of parents, active parents. I think everybody on our board were parents, basically, that said, what do we do to get out there and to make a difference and to put our stake, and we need to go talk to the legislators. We need to get out there. And Santi, and I'll give you just, I mean, I've worked with this guy for 18 plus years. He is the best director in the state of California for supporting housing from a regional center perspective. He absolutely is. He has done more for San Andreas in being able to create opportunities and funding Housing Choices Coalition and helping to start Bay Area Housing Corporation that I'm the director of. When we closed Agnews Developmental Center, we came up with a prototype of what do we do with the people that have been housed for all of these years, and how do we create lives for them in the community that make a difference. The challenge is that the people coming out of the developmental centers, there was a lot of funding that funded them as they moved into the community. There's not as much funding for the families that are sitting around this room where you have kept your child at your home, and now you're going, now what do we do? That is the next huge challenge.
That's the perfect transition.
Thank you.
Thank you, because you know, I'll try to explain it a little bit more. We have right now in California a de facto two-tiered system, they call it. There are people with developmental disabilities who had been living in the institutions, you know, like Agnews, the developmental center. And in order to close Agnews, the state has funded all of these residents in the community, you know, in their own apartments, in group homes, various living situations, you know, with appropriate staffing. And, you know, I'm not saying they were living luxurious lives, but, you know, those people are pretty well funded and well cared for. If you are a person with a developmental disability who was not previously living in an institution, this is what Kris was referring to, you aren't entitled to that kind of level of service and funding. So, Kris mentioned, when the plans for closing Agnews came up, they came up with this, you know, series of, I don't know, pilot projects, not really pilot projects,
They were pilot?
They're pilot projects to create really group homes, more or less, but specific kinds of group homes in the community, right? Well, this brings me to my question. Group homes. So group homes are the second most popular option after staying at home for adults with autism, just in terms of the sheer numbers. In reality, if our kids move out, they will most likely move into a group home rather than into their own supported living apartment. That's just, I'm saying that based on the numbers, not because I think one is better than the other. But we have a problem with group homes in that there aren't a lot of them, you know, suited to our kids. we have thought about the idea of creating, a pilot of new group homes for, different adults, but including adults with ASD who may have need for space, may have need for trampolines and swings and hot tubs or pools or, certain materials that are kind of impenetrable, like, different things, and maybe different staffing ratios than are available now. What is the chance of doing a pilot group home project with ASD clients in mind? Okay. Anybody?
I just want to comment first. It goes back to the whole issue that we need to change the way we think in our advocacy, because if we don't change the way we ask questions or how we advocate, then the responses are going to be the same that we've heard over the years. And one of the things is that, and not to necessarily disagree with you, but you say this is
feel free.
Okay, then I won't disagree. I actually will disagree with you.
Fine.
Yeah, because I got my dinner, so it's okay. And I got to make sure I got my ride home, though. So I won't disagree with Tony. But the whole thing is, you mentioned the two-tiered system because of the developmental centers versus the community. This system is multi-tiered in so many ways. There are people who are not eligible for services at all, simply because there was a rule placed that lowered eligibility in 2005 because of the budget cuts, that shut out thousands of children with autism and other disabilities from the system. That's a tier. There's other tiers of services depending on where you live in California. Some people may get all kinds of services they need, and other places they get none. And they can have the same disability. And they're not in a developmental center. There are people who can access services and housing in some parts of California and are shut out entirely. The reality is, if we define this only as simplistic as this two tiers or the problem is simple to solve, then we are misleading ourselves and we'll never find a solution. The problem is entirely difficult. Entirely difficult. The solution, though, is several. One of them is actually the things that Kris and Santi and the others have gotten together, is to try to find another way. Just because a door is shut doesn't mean you have to wait until someone decides to open it. My way is always, you don't have to have a door to get inside. You can drill something, right? And that was my way, is to find, But the thing is, we can try to find another way, different partnerships, different ideas. The same way of doing things will no longer be true to any of us. And that's not a bad thing. Disability rights has always been about change. We cannot stand still and think what will save us is restore all the programs and all the funding that we had in the 1990s or the early 2000s or restore everything from the past. Disability rights, about the people that we love and care for, is about change, about making things better. And it's about remembering all the people who need help, including the children, as you mentioned, including the adults, everyone, and including the people who have developmental disabilities who, just because they, by a policy decision made in Sacramento, don't qualify for any services under the Lanterman Act. Lanterman Act is a beautiful thing, but it's not the only thing. My sister was born before the Lanterman Act, before the Americans with Disabilities Act, before any of the Civil Rights Acts were passed. Does anyone think in this room, or anybody in Washington or Sacramento, think that my sister had no rights until those acts were passed? My sister had every right to be treated as a human being as soon as she was born. It was the state of California, it was Washington who were late in recognizing those rights. We have to remember that the tiers that we need to change, all the actions that we need to look at, is to change the way we view things. We can't view the Lanterman Act as just covering those who are eligible, because then we're ignoring all the thousands who were shut out. And then we've got to remember about how do we reach all the thousands who don't get services. So part of my solution, or part of the ideas towards advancing towards a solution, is outreach and education. Not at the state level necessarily, but at the community level. Autism Speaks. Housing, Kris, you've been great at this too. And that's what we try to do, Santi, when we try to do these big rallies and to bring people to Sacramento. And that's why I did the news report, CDCAN, California Disability Community Action Network, bring people. So many families, my family included, when my sister was still alive, have no idea what services are out there, or if they're told they don't qualify, they don't know what recourse to take. And by the way, a child or an adult has other options than just a regional center to receive services. There's Medi-Cal, there's IHSS, SSI, so many other services that are out there. We need to take advantage of every opportunity, every service, every program, and make them serve us. But that will only happen if locally groups like Autism Speaks, ARC, and all of us band together and work with our own communities to make sure they know this. Friends for Children with Special Needs has been really good about reaching out to families and to others who have been shut out, but we have a long ways to go. So education and outreach, and it also means educating governments at every level so they realize that our community needs to be served by them. Housing authorities, as you know, for the longest time, many of them didn't think they had anything to do with us, that the regional centers were serving our population. The mission of housing authorities, which is a federal-funded agency, is to serve our population. And we have to remind governments at every level, city councils, city governments, everywhere, county governments, that we are there. We are a community that needs to be served. So we need to press everywhere and to get in every door. And like me, you carve out a little hole and you go through it, or you get a key. Santi has a key now. I'm going to be Santi's best friend, right? We're going to go out to dinner and lunch and everything. No, but seriously, we just need to find other ways, other doors, take advantage of every opportunity.
Also,
All right, Tony, please.
Also, as a reminder, sometimes these questions can be a little dangerous.
Can you lift up your microphone just a little bit? Do you mind?
Yeah, he says it's dangerous, so he just wants to.
That's right. Okay. Fly me to the moon.
Oh, my God.
I'll sing to him all the way home.
Show tunes.
I remember I started with questions, because questions can be a little dangerous, and from our experience, sometimes we answer them wrong. And I think of a great story from the book, Purgatory, Christmas in Purgatory. And I think everybody, if you don't know the book, you should. It's very important for the history of our community. But in the book, there was a time when they finally asked the person in charge of a unit, if you had enough money, what would you do at this developmental center? Because it was overcrowding, it was horrible, and the timeout rooms were always filled. And he said, if I had enough money, the way to serve people with developmental disabilities would be to build more timeout rooms. And that would solve the problem. And people would be well served and happy and safe. So the question was a good question, an honest question, but from his experience, he's locked into only a certain way of thinking. And if we start to ask ourselves these kinds of things, you could think of how, if you said, well, how about a good group home? And you showed somebody a really nice looking group home and said, is this good? Yeah, everybody said, that's great. Well, it's so great, why only serve 6? Why not 8? 8's not that much more than 6. And then what about a one right across the street from it? And then what about their doctors? It'd be nicer to get to their doctors, and what if we just move their doctors? And all of these great ideas that you could see that people really need develop into these segregated communities on accident. They're all well-meaning, but they develop into these kinds of things. And they're the need that we need, and they seem to be simple. And the one point I would make is we definitely need a systemic approach. I wouldn't deny that, but maybe the systemic approach is to get really, really good, as Marty always talks about, being able to talk about your needs and your IPP. This is your contract, right, with the state. The ARC versus DDS is the proof that this is a contract. It's the system that we have today. And if you cannot, in your IPP, get your needs laid out and met, then it doesn't matter, really, what kind of thing that you've set up if you want the regional center funding that piece. Because that's the contract with the regional center and you, as an individual and a family, that says what those services will look like. Maps out your needs, what they are, your history, where your goals are going, and what that needs to look like. And if that's not effective, then we're not building the kind of system that we set this up for. This was all about that the family unit, the individual themselves, deriving what their needs are going to, how their needs are going to be met. And if we sit back here without knowing that, we just set up some nice homes or some nice new services for people, and yet that might not even be in IPPs. We don't even know. It's got to be driven by what the individual needs. And if we lose that, we're going to be in.
Boy, nobody's answering my questions tonight. Well, I would say yes and no.
I took that answer.
Gosh,
That's not true. I mean, you asked a question about group homes, and I think, we try to respond that we've got to think differently. Here's the thing. You were referring to the DCs as developmental centers as being institutions. There are some advocates, disability advocates, who would view group homes and intermediate care facilities as institutions, or more restrictive settings, which would be contrary to the 1999 U.S. Supreme Court decision that is known as the Olmstead decision. And so there are advocates in the community or in statewide who would actually criticize any effort to expand the group home model. What I say about rethinking things is that we do have to rethink things now. Times have changed. I think there are more options. And Kris, you actually helped provide those options with Santi over the years for people to choose. Supported living is now a real thing, but those things didn't exist 30 years ago. And so I think when we look at the Olmstead decision and look at the things that we're talking about now, I think it's not a bad thing for us to revisit, is a group home a good idea or a bad idea, or is it appropriate or what? I think it's not a bad idea to question that, because I don't think necessarily it is a bad idea for those people who need it, for those families who think it's important. But I think we have to remember history, and I think that's important, because, Santi, you mentioned that, because we don't want to, and I think, Tony, you were alluding to this, we don't want to inadvertently repeat history and all the mistakes associated with it without remembering it. Now, if we did it deliberately, if we choose to build a group home that has 16 people because we could justify that they're family members or whatever the reason is, and it's not a violation of disability rights, that might be a different thing. It's not repeating history, it's sort of reinventing, history so it fits the future. So I think that is at least my answer. I mean, because you're asking a question, how do we fund more group homes? And,
Yeah.
I think that the questions need to be asked first.
Yeah, well, no one actually defined group home. I mean, group home can be very large, but, most of the people we work with are thinking about 3 or 4 adults in a home with staff living in the community. So just to clarify that. And
I think I was just going to say, as far as we love Bay Area housing, we've been involved in a lot of the creation of some of the models of thinking about if you were creating something that would really work out there in the community, what would you do and how would you do it? So when you talk about this, autism and being on the spectrum and the behaviors, there's a lot of behaviors out there. So it's sort of hard to sort of plunk everybody into one setting. So you can just imagine that. But thinking about how to create housing, meaningful housing opportunities for people, I think it's a constant challenge. And I think it is one that we need some new models. I mean, I do think we need some new models. And I love the concept. I was an old PE special ed teacher, movement and having space and having beauty. And I loved your presentation earlier that it's treated with care and respect. If you ever came and saw the homes that we have created, people are valued in these homes. They are beautiful. They are well taken care of. So they're not the kind of homes. So when I think of a group home, sometimes it's like, oh goodness, but I love the transition that we're thinking about group homes. And group, again, where we have the numbers, if it's 6 people and under, you can actually have a home in the community that the neighbors really can't go after you. So we certainly like 6 and under. Frankly, we like them even smaller than that. I mean, I love three. I love three, 4 people if you have to. But I think smaller is better. And if there's natural partnerships of family members out there where you can start to create your own type of things, that's something too. Or if you have a home that you might think you know, I've got a home I could maybe donate and get, you know, we want to do some advocacy of getting some tax benefits. If you donate a home, that you maybe get a tax benefit, and if you have 2 or 3 other people, that the regional center is able to have some other people in there, and you're creating a legacy for that home to be able to serve. Those are the kind of things we need to come up with. And those are the kind of things I love to imagine. What are the possibilities? Because that's the creation of what we need to do, I think.
Jill, I'm just going to add to this because silence doesn't mean didn't have reservations. And anytime we use any word, we need to have good explanations of what our desires are. The use of the term group home, I would love to have done a nice research on everyone. The minute you said the word, with great affection, because I like you a lot, and capture what you were thinking when you heard that. Those 2 words, group home. Group home does not describe anything to me.
Me neither.
In my practice at this point in time. A wholesome place to live, that there may be more than 1 person or 2 persons living there, is a place to live. When you design on the individual part, this is not some, this is not some drug-induced thing that I'm talking about. I'm talking about approximations of what we've already planned to do. An individual plan operationalized. Having people at different stages in your life, and many of you in this room are already experiencing some of the things I'm talking about, but you don't need to disclose it. At different times, you lived with more than 1 person, and other times you chose to live by yourself, and other times you had to live with 4 other people. Whatever those circumstances were, there's lessons in that we have generalized that provide for it through the whole transition of life. There's nothing touchy-feely about this, what I just said. I can close my eyes and describe them and take you to some of the places if people allow us to go visit them. They like privacy, just like everyone. The values of the individual living there, from wherever that valued information, predominantly, hopefully coming from the individual themselves. Some of it is trial and error. But the living arrangements now, the notion of group home really requires immediately a description. We have a number of homes licensed under California under community care licensing. Now I have to teach you this. That are very specific in the rules of how many people live there and what rules you would live under. You also have health care licensed homes that people will generalize that label on them, that's also a group home. And from there comes all of your frame of reference. And I'm suggesting to you that is a real rush to judgment. We are not building throughout the state of California more traditional group homes. We have not been doing that for a number of decades now. They really manifested that. It does not condemn, listen closely to what I said, of the ones that are existing, the good quality of lives, I would hope, are being provided to those individuals who live there. Many of them, in their older years, have lived there and choose to live there, and that provides a living arrangement. They outlive family members, all of those good things happen. What is really being built are more individualized living arrangements. 3 or less people throughout our state. The families have engaged in that. Some of those families come forward and suggest to us, I happen to have this, and this happens to be a piece of property with a home that was used for renters or others, and then you convert that to what's in the best interest of those people who are going to use it at that point in time. We have vehicles by which that are administrative to administer those. What other the licensing or organizational design. Supported living is shown itself with a lot of flexibility that 2 or 3 people living together, sharing common areas. Some of us in this room got through college. Oh my gosh. Oh, I'm sorry, I had a bad flashback. Sharing areas. Some of my roommates who were not as tidy as I am. Okay? But the serious part is that those are kinds of considerations that you're not, please note this, you're not locked into for the whole term of your life. The more advocacy you have in your life, that's called family, the higher the quality of your service. Go test that. That's really accurate. The more advocacy you have in your life. And we have had some really great designs that many people told us, like Burton Black, who wrote Christmas in Purgatory, from the East Coast. Know him really well. He's in heaven, I hope, because he was an extraordinary physician. Chronicled, because he knew it was going to make a difference to people, to visualize what were they thinking when they were providing what they thought was high-quality care. That was not 100 years ago. It was during my lifetime. That's incredible. So here we go now with the same kind of, where would you live? Where would you live, sir? Where would you live, ma'am? And what would you need to have there? And what was your son or daughter or loved one want to have as basic and essential to their life? And that requires lots of engineering. And we have now have products already on the ground relative to the house. But what's in the house is really the important aspect that everybody on this panel is talking about. What's in that house. That's not just some mythical thought. We can measure that, and we should be obligated to measuring that through the full course of it. So I think we have some of those ideas, and that makes a lot of sense. There's a lot of transition. And please, I can't get through a whole evening without telling you, multi-generational living is the future. Okay? Multi-generational, not to distract you. But I think when we have a chance to talk privately, I can describe that.
There's a gentleman way up there.
Yes.
You know what?
You don't want to do
Okay.
that.
No.
Okay.
I'm gonna ask a couple more questions, but my question card person. If you have any questions, can you please hand it to our
Could I just say
volunteer? Go
something
ahead.
real quick?
Yeah.
One of the other things I wanted to just sort of piggyback what Santi said is we have a very good friend. His name is George Braddock, and he's out of Oregon. And we've worked with, Santi and I worked with him for 16 years, and he's an incredible guy who has a daughter that's on the spectrum, and he wrote a book, and it's called Making Homes That Work. And this is around, if you have a family member, and they are currently living in your home, and it's not working, and you want to make it work, this is a really good book to perhaps take a look at to see what might be done in your own home to be able to make the accommodations that need to be done in your own home. And I'll give the information to Jill, and anybody like on the list could take a look at it, but it's very good. It's called Making Homes That Work. George Braddock, B-R-A-D-D-O-C-K, is the publisher, or is the author. And we work with him all the time, and he's a great and very knowledgeable.
Okay. Santi says something that we definitely agree with in part.
Okay.
This is a night for us to be able to disagree a little bit, which is it's not the home itself, it's what's inside the home that matters. That is mostly correct. Okay. But for a lot of our kids with autism who need space, and need certain amenities, it's also what's, within the four walls and outside the four walls that matters quite a bit.
And that's exactly what I meant.
Yeah. Okay.
As well. It's the environment in which you're going to live.
Yes.
And knowing what you know and what I know as well, space is a critical part of that environment.
Okay, so I just want to say that I'm not delusional when I say I think we need a new model, right, to serve adults with autism, because some of what's out there now is fine for other people, but isn't enough, right, for our kids who have physical, behavioral issues. And
could I just say?
Please go.
I had the chance to go up to the Mind Institute a long time ago and see, just walking in there and the colors that were very soothing, the type of the furniture, and it really made me think about, okay, what are the ways when you're designing homes to be very intentional about color, about space, about all of that. And I think, the whole thing, not just saying it's just autism, but I think it's taking into consideration the population that you're working with. So I would agree that I think there's some things that we can do collectively together to be able to do this. And there's a lot of other people that are a lot like a lot of other people as well.
By the way, there's no funding for any of this stuff we're talking about.
But
So- So you can see we have our work cut out for us. Can I get the question cards? Yeah, because we're going to start with that pretty soon. So we're going to talk about what's inside the, Santi, when you were talking about, what's inside the home that matters, I thought you were talking about the staff, because that is what matters,
Well,
right?
look, all the relationships, and listen closely to this, I say that often because I want to make sure I'm understood. And you'll find me, most people find me eventually. So it's about those relationships, and they are active part in all of our lives. It's really the critical part about those relationships. The environment in which you work in, I've seen incredible ones from what I was just preaching the gospel according to, a wholesome environment to live in. And then I went and visited a reconfigured warehouse, and then in that warehouse had an art studio. And within there had another little thing, and from the outside, it would not have fit any of the licensing or any other requirements. It was one of the best places for the people who lived there. They were interacting with their life. They were planning it. Of course, it was not in the state of California, but it was a great life. And you have to have the ability to individualize. The word individualization is throughout this. To practice it is a real challenge. It's a real challenge in our state, and I'm just suggesting to you that's plausible. So the whole aspect of all of our individual rhythm of life needs to be engineered, and it has to be adapted. So so I don't believe there's just one prototype that really does all.
Let me explain something a little bit, and maybe why we're talking a little bit like this. Tony, we are 100% with you about individualization, 100%. No two people are alike, and what housing, what programs work for one person doesn't work for another. And we are absolutely about serving the individual where they are. Absolutely. At the same time, we're pragmatic, and what we don't want to happen, and what we're kind of seeing right now, is parents who are already broke, exhausted, working so hard for their kids and themselves, having to reinvent the wheel every time. We want to get to a place where you're in that IPP, right? And you're talking about, individualizing the IPP. But you don't have to say, oh, well, I want a group home, and I don't know, I'd have to find some people, and I need it licensed, and I need it funded somehow. I don't know. We don't want people reinventing the wheel. We can't do it. We don't have the bandwidth, right? We want to create some wheels, right, that people can use. We want this menu of options, right?
Right.
The menu of options. We want to go, to quote my friend here, to the Cheesecake Factory, right? And here's your menu, and you can choose, right? Rather than reinvention. So my concern is that sometimes, we in the autism community can be kind of idealistic and a little ideological, which is fine, but you also have to be practical. And, when it comes to, I'm sorry I called it group homes. I don't care what you call it. Congregate places where people live together in harmony, let's hope. That there is this array of options that people can choose from without so much struggle and so much confusion. Does that make sense?
No, it totally makes sense. And Jill, you started the question with, with the premise that we can't have supported living. So there was already...
Oh, no, that wasn't a premise. I'm just saying in terms of numbers, it's lower.
We're not getting supported living.
We like supported living.
Yeah, but that option right there is exactly how you explained it. That is somebody sitting down and reinventing a customized living situation for themselves. And if they're with their family, it's with their family. And sometimes it's with another person that they're with. And that's how that option is supposed to work. It's supposed to be this labor of thoughtfulness, this trial and error. They find the right house that meets the color, the hue, the size, the backyard, the kind of neighborhood, and all of that is very complicated. It's not on that menu, although it is. If it's on the menu because it says supported living, then that's one level of it. The next level of it is how you customize that living option to meet your needs. Now, the other piece would be, I think what I struggle with is you're looking for policy people to tell you one policy that's going to give you a certain service across the board everywhere. And I think that's what you're not going to get. I don't think you're going to get policy people telling you everybody should have 5 rooms, or they should all be blue, or or some kind of model.
No,
set.
I'm not.
But what we would tell you is that first it's the IPPs, the individualization that we agreed to, and if that's not working, if that supported living piece is not an option for you, it's because the IPP is not working. It's got to work in the way that everybody agrees that this is the best way to meet your needs. And if a group home that's existing today or whatever's out there is not in that, and you're getting forced into that, then it's not working. It needs to be improved. And I think the systemic fix here, or the policy fix, is to improve the problem in the IPP on that one, and that improves their housing option.
I think the problem with this, you raised a good point about the menu of what's available, and I raised that earlier. But it wasn't, it's not like someone needs to hand us something and then therefore we now have knowledge. That's not the problem. The problem is a lot of people in the communities that we're a part of, and my family was like this, they didn't feel engaged at all with what was out there. And it was hard to explain your own situation and to understand what was out there. And so it does, I think one of the things that we're going to have to step up on is community groups will need to step up, not necessarily going to Sacramento, but going to your own community, and we need to really outreach to our families, not just those who are eligible for regional center services, but those who were shut out. It's really important to remember that, not just informing them about individual program plans, IPPs, but a lot of our people get other types of services that have other types of plans. If you have Medi-Cal, you could have a medical plan of care. You could have, in IHSS, you have certain types of care plans with in-home supportive services. And so we need to help train people, the people who receive services, their families, the support staff, providers, everyone else, what's out there. What's the right choices to make? Not the right decisions, but what the right choices are out there. That doesn't really exist. It kind of exists, in sort of a spotty network across the state, but it's not systemic. And it's something I think community groups like Autism Speaks, CDCAN, ARC, the rest of us, we need to step up, and every one of you in this room, providers, family members, we need to step up and reach out to our neighbors and to our friends who don't know. And there's also an element who don't care. I will remind people, funding isn't the only problem. It's knowledge. And from knowledge, then you start asking questions and you start pressing. And here's a good example. Back in 2005, I spoke at a forum at the Mind Institute. About 200 families were there, families with autism. These are family members whose children back then were young. And those parents, as you well know, or feel and understand, those parents were desperate for help because nobody was helping them. None of those families, when I talked about in-home supportive services, IHSS, knew what I was talking about. Not one person in that room. And yet, probably half of those children were eligible for in-home supportive services. Services where the parent or an outside person could be hired to provide services in the home for their child. And yet they didn't know. And so that, whether we want to sign it as being deliberate on the side of the regional center, I don't think that was necessarily true. I think what it is that across the state, across this nation, there is an absence of information that's vital to our families. And it's not, we can assign it to conspiracy. Whatever the reason is, I don't really care. All I know is we have to do something. And whether it's to friends of families with children with special needs or other groups, we need to band together, and that's why I formed CDCAN, but other groups can do this too, and reach out and provide this information about what is happening. Small step. But guess what? After I talked about IHSS to these families, a lot of these families got services that they didn't have before, and had nothing to do with funding cuts, that they were denied those services. So the burden falls on us too. It's not just pointing to Santi as the new director or others in the state of California or the other policymakers. We got to look at ourselves too, and what is it that we must do differently?
Marty, so
and that was my hook.
So, you know, just to make you feel a little better, part of our mission is exactly what you were just talking about. I mean, we want to be a source of information using, you know, our website. We are trying.
Well, this meeting is a good example of that.
Yeah, and we catalog so much information on our website. So much more is coming to help inform people who really don't know what the options are out there and the pros and cons of each, and you know, some of the priorities that are emerging. Something that's come up in a lot of the meetings we have is exactly, I think, what you said, which is this kind of the counselor, you know,
system navigator,
the consigliere, you know, to come in and, you know, work with the families. You know, the regional centers can't, and often don't, you know, serve that role. So we totally agree with that. There has to be a lot of information. It's not just money. I'm going to go to some questions. I'm going to start with this one. High functioning autism and Asperger's syndrome. Any housing oriented to these types of disability? I'm actually going to start with a little answer myself because I'm in this business. I'm a real estate investor, and we deliberately try to rent to people with autism. We rent to people with Asperger's and high-functioning autism. And the key, from my experience, absolutely 100%, because these are people who you really can't make a lot of money. Section 8, vouchers, 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 and more vouchers. These people are very adept at living in the community. They want, on my tenants at least, they want to live in the community. They're thrilled. You know, they're near the bus line. These people are on Santa Cruz. So, anyway, oops, sorry. You know, they're near the beach. They love it. They are happy, but they have no money. They have no assets. The reason I can rent to them is because of this thing through the federal government. We talked about HUD, and it was mentioned here tonight, was vouchers. Our community is the poorest of the poor, right? We can look at the disability, you know, community broadly, but our kids, especially kids like mine who are nonverbal and will never work, they are the poorest of the poor. They cannot get housing without vouchers unless they have, you know, a rich family member. So that's my answer as someone who's in the business. And there is right now no priority given to, you know, people with, you know, severe developmental disabilities, which I think is a shame. I think it's horrible. But I'm going to turn it over for other answers to other people.
Our housing expert. Although I would mention that we did lose again this year in Congress with 811, so we lost another.
Yeah.
But that's different than the vouchers. So, but the housing stock available has been continuing to decrease.
The question, I think, was about where can people live that are high functioning as far as what are the options out there? I mean, there are, again, get registered with Housing Choices Coalition. There's set-asides that are there that come up. There are different opportunities as far as being out there. I've seen people be served in a variety of different ways, from being in apartments, from being in single-family homes, from being in co-op housing, from being in whatever. And Jill is absolutely right when it comes to the Section 8 vouchers. Unfortunately, that is something that comes up. The waiting list is huge, and we're trying to get more and more vouchers, but that's a federal thing, and getting more rent subsidies, just getting more money that can come in. The average person, we all know, that gets Social Security, it's $850, $870, or in that range. And think about the rents. I mean, look at this, where we're at in Palo Alto, one of the most expensive places in the entire United States. The median price of housing here is incredibly high. So that's our challenge, is to be able to get in with the cities, with the redevelopment. I mean, and we know what happened to the redevelopment agencies. They went away. So our housing world has been blighted over these years. But I'm the eternal optimist. You just keep on chugging away. I saw something last night. Don't get mad at me, but I'm just going to say it. Pete Seeger was an interview with Pete Seeger, and he was describing that if there's a seesaw and you got a half, like a bucket of half of rocks, and it's all down way on the ground, and he was talking about change. He said, if everybody just puts little teaspoons of sand up on top, it can jointly, so we got a lot of rocks down there, but it takes a lot of the teaspoons of sand that is just going to continue to drip on that. But most importantly, parents, is get involved and show up, because I know the family members that I'm looking out there that have showed up at meetings, they have found opportunities for their children, and it makes a difference to be involved. And I think our other responsibility is for all of the other family members that can't show up at meetings like this because they can't get away. So you need to be partnered up with other people and be able to share this information.
We're going to be working on vouchers in a
okay.
big way. We're going to ask people for their help, believe me.
Sure.
Do we have one more comment on that before we go to the next question? Nope. Okay, let's move on. What can we as parents do to help legislate and or advocate raising the low wages that plague the housing staff sector in group homes and other care facilities? I think that would also apply to supported living. It seems like a colossal task, but necessary. Who wants to take that?
Well, you can definitely get involved with, locally first, and then in the Capitol. And just Marty has some great resources to keep everybody informed of the latest updates. We have some great resources to keep people informed. We ask people to act on them, respond. We've seen incredible changes inside the building at different times when people get together and start flooding offices, or when they call and they have a good connection. So they're so critical. We've got a few things that we're working on right now. We've got a collaboration. It's called the Lanterman Coalition, and it's been going on for a long time. There's about 16 statewide organizations representing people with developmental disabilities. Half of them provide services. We got labor there. We got Ms. McCoy there. Hello. And she's in the group, so if you don't like it, get on her. But we have been working for quite a long time. The minimum wage increase, that California did, there's one thing, but it didn't have funding for the state, so we had to get in there and fight for that. That's there, now it has to be done correctly. We probably will need help there. And then we've got several things that are in the pipe right now. I can't tell you all of them, but there are several things that these organizations are in the middle of doing that will help to reform the system. Actually, reform is not even the word we're using, just to relook at what we're doing and see how to restart it, because we've gone through all of these massive years of changes. Just since 2009, we've had 60-plus changes to the Lanterman Act. That's why this guy always carries a new one, not because he always has to have the latest, it's because the other one's not in date. They're out of date, so he's got to keep the current one. But that's a lot of changes, and if you look past in the last 15 years with all these rate freezes in the entire system, that's why the pay is so bad. I mean, the providers aren't getting rich and holding the money and not paying the workers. You do what you can with the money you get, but they've been frozen for over 15 years. That's a long time to be frozen, and then on top of that, there have been cuts, so you get cut as well. And I can guarantee you, whatever you pay for your water today, or your power, or your gas is a lot different than what you paid 15 years ago. But they're expected to survive and pay a livable or competitive wage to these people that are critically important, in my association's view, critically important to the success of the system. And for people to live in the community, people with developmental disabilities, to live in the community safely, we're asking people that we don't pay very well and we don't train correctly, in our view, I'm talking broadly, to do a major job. A major job that's critically important to our families, and it's not right, and we need to fix it.
Santi,
and we are some things we're doing. But keep involved.
Finding, paying, and retaining staff is really hard, right? We hear about staff challenges, staff turnover, parents working full-time to manage their kids' staff. What is one thing that DDS can do, to improve the situation?
A couple things are already done by the legislature and the governor relative to raising the minimum wage. But the minimum wage itself, as a private citizen speech here, well, look where we're sitting. In this geographic area right here, just 2 miles radius, it doesn't accomplish much.
Does not.
Relative to that. And I know the governor understands that this is incremental changes to big sweeping public policy across all 58 of the counties in California. And in some places, that is a modicum of approaching to a better minimum wage. In these geographic areas, our efforts have to really be intense. Raised significantly in geographic differences, adjustments for geographic differences. That is not a populist position. Many of our legislators are aware of that. It will compete with a lot of other issues, but to let it go silent is always a mistake. Silence.
So it's something that we could work on.
Yes, absolutely. But the realities are, how is it that people can actually afford rent here? And I'm not going to embarrass anybody in the room. I mean, how many of you are renters rather than owners? And how much would the rent in this geographic area be? It's incredible.
It's
my mother was a retired broker, so it's in Santa Cruz. It was more. They rented by the square inch.
I just want to, if I can comment, in looking at the question regarding the wages, which is really horrible for the people who provide services, but looking at that problem and then looking at what we can do, we need to look at the total problem. Remember, we got to be smart in our advocacy. We got to really start asking questions. And we got to look at the lay of the land. And we look at the lay of the land, and there's been so much devastation to the health and human services system across the board. SSI, SSP, cost of living adjustments, payments were cut, and then the automatic cost of living adjustments for the state portion of the SSP grants were eliminated. In-home supportive services, wages or hours were cut, 8%, and now 7% in July, and I think it will be permanent. Initially, there was a plan to impose cuts that would have eliminated services for about 80% of the recipient population. That was blocked by courts, but the result was these permanent cuts that are in place. IHS workers in many counties are making minimum wage, doing the same work, getting minimum wage that another person is getting $12 for somewhere else. We have Medi-Cal providers who have been underfunded for years, and their rates were cut, and now they're being assessed a cutback retroactively to June 2011. So some providers being exempted. Medi-Cal benefits, which many of our population depend on, not just those with developmental disabilities, but the general disability and senior population, benefits were cut. Important benefits that people depend on, including adult dental, which will be partially restored in May, but most of the other benefits remain eliminated. So if you look at all those things, look at the early start reductions that pulled back on eligibility that made many children ineligible for early start. You look at the eligibility changes to the regional center system that shut out thousands of people. And so what do? What thing do you restore? What thing do we go to Santi or to the governor or to the legislature and say, restore this or restore all of it? CalWorks, the Welfare to Work program, grants were slashed to the lowest level that the federal government will allow. And so what do? And the problem for us as advocates and as people in this own community is when that question is asked, publicly we will say the right thing. Restore all of it. Privately, we will go to our own legislators or to our own meetings with Santi. We'll take him out to lunch and thinking that we pay for the pizza and he'll do what we say. And I don't know why I said pizza. I'm sorry, because you said Italian. And but the point is, we think we will say privately, restore my program, do something for supported living, or not really, or do something for the group homes or whatever. And that is the advocacy we need to change. We need to stop that. We need to band together as a community, and I don't mean just in a Hallmark card way, but we need to realize that everything is not going to happen in one budget year to make our system better. But we got to start, and we got to be honest with each other. And we are not, I will say right now, on this stage, and everyone in this audience, we're not honest with each other about what we want with this system. We aren't. As good as we all want to be, we're not. And that's got to change too. And so, in the next coming months, I think one of the things I did, I was appointed to be on the Task Force for the Future of Developmental Centers by the Secretary of the Health and Human Services Agency, along with several other stakeholders. But one of the things that I pressed in terms of the recommendations, which did make it into the recommendations to the legislature from the administration, is that the department would form a task force that would be looking at rebuilding or steps to rebuilding the system and prioritizing funding issues. And I think that's what needs to happen. I think the department, the state of California, needs to bring us together as advocates and stakeholders to look at the entire system, look at the other Health and Human Services Agency programs, and determine what things can we move on first. And not only just restore what was, how do we rebuild what needs to be there?
All right, I'm going to move on to some other questions. We have a huge job ahead of us. Let's just say it.
Yeah, but you know what? We can go to every question, but the thing is, there's like 3 things that we need to concentrate on that we have not done, and frankly, if we don't keep drumming into all of us, and that means me too,
okay, make it fast,
we're not going to do it.
Okay.
I've been around a long time, okay?
I haven't.
I have.
That's what happened to you.
Someone says, could you create a list so we who want to share housing with other families around, that we could be on, a list that we could be on. And we think that's absolutely fundamental to have that kind of network of parents who can all talk to each other so that we can start building new solutions and new group homes, whatever they are. And we hope to do that through Autism Society, over the course of the year to create that kind of networking capacity. Kris, do you have any other comments on how parents can find each other and support each other to
I just think
share their visions?
Getting together and talking about it. And also, one of the things we did a long time ago at Housing Choices is that we even got some of the family members together to dream about what they would like, So, I mean, to involve also the individual that is your loved one that has a developmental disability into the conversation, rather than it just being the parents that are going to the meeting. Sometimes bring the others to be able to do that. So that was a nice way where we're starting to hear what they really are interested in, but then building that list and that support. So whether it's a group serve or something like
one thing that we've started doing is kind of supporting regional housing interest groups. So right now we have 2 that are running. One's in San Francisco, and one is kind of based in Fremont. I saw Irene, you're here somewhere. Irene is heading that. I've been talking to other parents about starting more, some on the North Peninsula, the South Bay. There was one other, I forgot where it was. And hopefully we'll get more and more of these regional interest groups going where parents can physically meet each other and really start dreaming. Like, we have to dream, people, because the solutions for us are not already out there. So we're going to dream away, and we really agree with that.
And can I also say that I know I'm looking at 2 people over there that started dreaming, and that's literally how 2 nonprofit organizations were formed that got major funding from San Andreas in order to go forward and to create these homes. So it comes from grassroots and families coming together. I believe that.
Absolutely.
Mm-hmm. A lot of these questions are asking for very concrete ideas. And I'm going to make an editorial comment that aside from Kris, our panelists are not, they're not concrete idea, people. They're not the service providers. And you can tell, they're policy people, as I've been reminded, policy people.
Yeah, right.
I'm made of plastic, I guess.
But I want to say something about Santi, because I've gotten to know him a little bit. Santi will listen to our concrete ideas,
yes.
Right? The people at DDS and even the people at the Regional Center, although I love many of them dearly, they are not idea people. They are not really problem solvers. That's not exactly their jobs. We're going to have to fill that role. We're going to have to figure out solutions and sell those solutions, right, to Sacramento, to the regional centers, et cetera. And we're all going to have to work together on that. That's I'm not even going to ask some of these questions because I know the answers I'm going to get. So I'm sorry about that. They're great, great questions. Oh, this is somebody else asking about how poorly paid staff are. What do I do if my child has become dangerous and this is a crisis situation and because of the behaviors can no longer live at home? What are my current, right now, this moment options?
If you're a regional center client, you call us. And sometimes, hopefully, the response is responsive. And the closer and the more intimate the relationship is with us, the higher probability. In other words, you let it know that you're in a crisis situation. We have hundreds of these through a course of a year through the whole service system. And they go on, and from that point on, hopefully we'll have a good remedy. But I know personally, many, many families, the trials and tribulations of haven't slept in 3 months, trial and deliberation. So that's what you do. That was one of our missions. And if we don't execute it well, you complain about it. That's the other part of your mission.
Okay. I don't quite understand that question.
While you're looking for
Yeah, go
questions,
ahead.
one other thing, if your child's in crisis or friend is in crisis or your service provider is in crisis, if any of those things happen, another alternative, if the regional center is not available or your child's not even a part of the regional center system or your friend isn't part of the system, contact your local legislator, your local elected representative. Explain the problem, ask them to open some doors for you or give you a list of available resources in the community. They need to have that information. And here's another reason why you need to do that. Because by doing that, and if we all start doing that, it will start demonstrating in a very concrete way that there is a problem out there. They should not be shielded from helping you. It's not their role just in Sacramento to cast a vote. Their role is to represent you in Sacramento, but also represent you in the community and to help you. They're your elected representative. We talk about the Lanterman Act as being the most valuable part of our legacy. It is. But the whole idea is it was inclusion in the community and that all the rights belong to us, to our families and to our children, to our brothers and sisters. And that right also includes the right to vote and the right of representation in government. And so let's not forget that our children, our families, our workers need to be represented fully, not only in Sacramento, but we need to get our elected representatives to help us in our own community. So if you're in trouble, contact them, get them to help you and open doors for you. Because mental health, as we all know, there is limits to what regional centers can do, but it is a horrible situation for any families going through that situation. It's just horrible. And so we all got to band together to make that happen, so make your legislator help you.
This is a question for Kris. This comes up a lot. How can we develop residential care, closer to our homes and in better neighborhoods? So, in the Bay Area, if we're going to develop housing for people with disabilities, it's usually not affordable in better neighborhoods. But you have developed housing in better neighborhoods. So do you have any ideas about how this can be accomplished ongoingly?
Oh boy. It's tough. It really is tough. We were lucky enough on some of the homes that we were able to do that we had some of the funding that went along with it from the closure of Agnes. So we did have funding. One of the things that was real important to us is that we had homes that were in communities where people wanted to live. I had my Darcy test. My daughter, who was in the wheelchair there, she needed to get outreach and go home, but it's like I didn't want, why should, I'm a mom, I'm particular about where she should live. I mean, this is where people should be living, where it's safe, near a bus line, people can get there and do that. Is it more costly? It is. And that's what we basically had to sell, that it was worth it to be able to get that. So when it comes to location, it is money, and we need to advocate that we need to be in some good areas. And, you know, I don't feel comfortable in some areas, so that's where I think we're advocates to be in good areas. So, you know, it's unfortunately back to the money.
It's a good point, and one thing I'd add is the safety of the workers, too. My daughter was a support worker in Sacramento, and there was some pretty bad places, because that's where a lot of our people live, because it's low rents, but it was bad. And I have to admit, I was fearful of her safety as she was, and other people were. All the workers were fearful of going to certain neighborhoods, but that's the work that people have to do. But if you compound that of being paid low wages on top of that, it's just really, really hard. And I think that's a problem that we all have to work together on and confront it, because it affects all of us.
And they're not only vulnerable, they're vulnerable individuals in vulnerable communities, and it's not good. So to me, it's the advocacy of paying some extra money to be able to do that.
Someone says, I'm asking for a committee regarding residential reform through legislation and problem targeting or problem solving. And boy, what a good idea. Boy, what a good idea. I mean, I'm not a fan of bureaucracy and committees and task force. I've been on so many of them and think tanks. But, oh my goodness, we need action, and maybe, a committee, or, maybe we can self-appoint ourselves, to create some of these solutions or key policy goals would be worthwhile. An advisory committee to Santi Rogers.
Let me just suggest, it's not an avoidance behavior. This is California. I love California. This is a country, also called a state. There are regional differences within this great country, California, and more local. Even one portion of California is bigger than other states that I've already mentioned. I think it can be very effective. Small task force that are time limited. Most of us have attention span issues, and can be very focused. Marty was talking about it. We've witnessed it. There's already a great product of a task force. Utilization of state developmental centers has that other standing one. From a state level, I think that's going to address some issues, but locally, there's no barrier not to have it through a regional center, wherever that regional center approximate is. In our 3 regional centers, that when we closed Agnew's Developmental Center, Golden Gate, San Andreas, and East Bay Regional Center, we had working groups simultaneously going in each of the areas to deal with housing-related issues. Housing is an intimate task to address.
So my question is, can we reinvent those for those who aren't coming out of the developmental centers?
The majority of our clientele live at home. Right. So, as you already established. So I think regional centers are quite aware of that. And I think through organizations like yourself.
Centers can't do anything.
What's that?
I'm already involved in a task force at my regional center, and they can't do anything but locally. We need to spread out. It needs to be with DES. It needs to be.
And we have.
We've got problems in our group homes, folks.
Okay.
Here in San Jose too.
Yes.
Very serious problems.
Okay.
Whatever
And
you want to call them, right now they're group homes, and we have serious problems.
okay. And there are, like you just said, there are ways and means to address that. Locally, these aren't mutually exclusive.
Locally is not working.
No, but in some cases.
Yeah, we are talking about
what I was talking about is addressing your.
I'm talking about here as a statewide plan.
As a statewide planning, there are vehicles already operational. So, but the more focused, the better.
There's actually some activity going on, and let's get in contact, because you would be amazed how delicate this has to be. There's a lot of people that are involved with this particular effort, and but it would be great to have more family members involved in putting this together. There are several legislators that are interested in doing this, and there are a lot of providers that are interested as well, but they're afraid. So the way it will get done, but it will.
Your families are afraid. Your
yes.
families are afraid for their children.
So that's why we have to have this, and it has to be done. But it will blow up on us if we just jammed it in. So we need other people to work on it.
I don't exactly know what regional center that you're involved with in terms of your. Okay, the committee. All right.
Okay.
Well, excuse me. The point is, he says it's not working, and I think the response back as advocates that we have to say is just because something's not working doesn't mean we can't try something and make it work. And I haven't finished yet. I haven't finished yet.
Hey,
you know, the thing.
Wait, hold on. My show.
I haven't finished yet.
My show, Marty. You only have about 1 minute because I have 2 more questions, then we're ending. 1 minute, and then moving.
Well, I got interrupted, so I just think that we need to change our approach when we deal with regional centers or local committees and with each other. And I think just because an approach didn't work, we got to make it work. It's got to work at the community level, because if it's not working there, it's not going to work at the state level either. And so your point's well taken. Okay, that model did not work. Nothing was resolved from it. But we then got to do something to make it work, to make that work locally. Because again, almost all solutions are going to be resolved locally. We can look to the state of California, but ultimately the decisions are made locally.
Okay, Santi. Anyway, yeah, I'll talk to you about what efforts are going on in the Capitol about autism housing. I'm not seeing it. You're seeing something that I'm not seeing, so we'll talk. Santi, quickly. There's a lot of questions in here about intentional communities for people with autism. It seems to me, I don't know why it's a contentious issue. To me, it seems like, you know, there should be many, many different solutions out there. Intentional communities, the idea is that our kids might need space or certain amenities or certain staffing that you can't get in an apartment building or a single family home. Do you have any feelings about, you know, the future of intentional communities?
Well, first, it'll be a great audience, and is this the last question?
You have 1 minute.
Oh, yeah. He has 1 minute, I have 1 minute?
2 minutes.
First, in deference to you, I respect you a lot. Operationally defining what an intentional community is required for me to answer that. Because I've seen all kinds of different varieties what an intentional community is. And I closed 3 of them. That's an intentional community. And so that's where the emotions come in, and the civil rights aspect of those of us who are really civil rights people who moved into that to deal with what Burton Blatt was talking about, Christmas in Purgatory. So we have to define what you're talking about, and then more than happy to give my opinion on it.
It's hard to define because they come in many different flavors,
Yes,
but it would be probably a multi-building or a kind of apartment complex kind of building where people with developmental disabilities live, maybe in concert with people without developmental disabilities, but specific to their needs, right, within the larger community. So what I've seen and things like, you know, having amenities, having a fence to prevent elopement, on-site management, on-site supervision, those sort of elements.
Well, you just operationally defined 3 different things in my limited little experience. That if it's restricted egress, fancy term for getting in and out of someplace, that's a whole different kind of service need. And there are people who can benefit from that who have another choice of going into a real intentional community where you don't have any egress at all. You know, maximum security, minimum
We aren't talking
security.
about that
I know
at
that,
all.
but I just want to use that as my 2 comparisons, okay? So the other part is that I'd have to see what that design is to really respond to it. Because every one of those things in some of our smaller living arrangements have those attributes you just outlined. And they have a really great rhythm of life, the individuals, have choice, every aspect of it, and have a good life, potentially. So that's why the universe is quite big. You want to narrow it for it.
Jill, we have a report that we spent a couple of years looking at across the country, and I'll give you that.
Yeah. I mean, intentional on that label. Yeah.
That is, but it
is
is a huge issue.
Yes, it is.
And it can't be answered in a minute.
Right.
Okay. Yeah, we're going to have, whoever wrote some of these questions, on February 22nd, we're having a different panel at Morgan Autism Center all about, it's called Dream Communities for Adults with Autism, and we have different speakers who are working on different models, and that would be a great place to really dig into some of those issues. I think you're right, Santi. There are many, many different flavors. There's not one, intentional community and all that. A couple of questions from actually service providers who would like to provide housing options for people with autism, but they don't know where to start. What advice do you have? Kris or Santi?
I would say contact us.
Contact Bay Area Housing
Contact Bay Area Housing Corporation, or if you're in the our geographic area, contact me. Would love to chat with you.
This is Bay Area Housing Corporation
Right.
and Housing Choices Coalition,
Correct.
also located in the Santa Clara
Right.
region, and the San Andreas Regional Center area.
Okay. Well, actually, I wanted to end right now, but I wanted to, for better or worse, I wanted to give time, and we have to kind of be out of here at 9, which leaves us with about 15 minutes, for people to talk to some of the panelists. So I am going to actually call it a night, and I want to thank everyone for coming. I want to thank our panelists. And,
Good job.
and we might disagree, but we really do like each other. So thank you.